Per diem means by day or as needed. You would have the opportunity to pick up shifts as they fit with your schedule. We require the nurse to pick up a minimum of 2 to 4 shifts per month. Some of our nurses supplement their part or full-time positions with per diem, and others pick up enough to work full-time. Per diem provides nurses with the luxury of flexibility. One thing to keep in mind is that the amount of shifts available on a per diem basis fluctuate, and per diem shifts run the risk of being canceled. The good news is we will always work diligently to do our best to replace any canceled shift. Contracts are more definite and guarantee the nurse work for a certain period of time. Most of our contracts are 36 to 40 hours per week, for a time period of about 12 to 13 weeks. These hours are non-cancelable and provide the nurse with stability. At the end of your contract, we will do all we can to help our nurse find their next assignment in order to eliminate downtime. If a per diem shift is canceled, the facility is required to let Nurses PRN know 2 hours prior to the start of the shift. If the facility does not abide by this standard and we are unable to notify the nurse 2 hours in advance, the nurse will receive 2 hours of show-up pay. Pay is specific to each facility, specialty, and level of licensure. You can expect that most facilities will pay more on the weekends, and some will provide shift differentials for PM and night shift. Talk with your recruiter for accurate pay rates for your specialty and level of licensure.
The overall hiring process from start to finish can go as fast as you would like it to go, but as a general rule, I like to tell nurses to allow themselves 2 weeks for hire. This process includes the online application, interview, reference checking, completion of online testing and e-documents, which are things like your payroll forms, employee manual, etc., necessary compliance items such as a recent physical and TB skin test, and finally, the drug screen. Depending on your placement, specific items may be required that your recruiter and compliance team member will go over with you. We do not reimburse for mileage. We do, however, offer high pay rates and have several facilities throughout the state in which we try to place you in a comfortable driving distance that is determined by you and your recruiter in the initial stages of interview and application.
We offer both daily pay as well as weekly pay. If you choose daily pay and you submit your timesheet the following day, you will be paid 2 days following the day worked except the weekends. We do offer dental, health, and life insurance that would become effective the first of the month after the start of your contract or after you consistently work 40 hours per week.
Once you become hired and active with Nurses PRN, we have a calendar where you fill in your availability for the days and shifts that you are able to pick up with us. We will then call you when your calendar matches the open shifts we have for our facilities. As soon as an open shift comes in, we pull our nurses' calendar and try to schedule as far in advance as a facility gives us needs. It could be as far out as a month in advance to a couple of days. We do have the occasional need that comes in for that day for a PM or a knock shift, and we do try our best to reach out to our available nurses. We really enjoy giving you the freedom to schedule your shifts when you can work them, so we do not mandate our nurses.
An online application, a short interview, 2 references per specialty, your dashboard, which includes skills checklists, competency testing, and some employee documents, also the compliance stage, which gets your certifications, final documents, physical, etc. on file. Yes, you will receive some sort of training or orientation at each facility. Depending on the facility, you will either receive a pre-shift orientation or an orientation of up to a couple of days. This will familiarize you with the floor, the systems, and the location of the items you may need.
At the end of your contract, you may transition your insurance to a COBRA plan through Nurses PRN. Of course, you have the option to work in a per diem capacity. As long as you are working 30+ hours per week, you are eligible to remain on your Anthem plan without interruptions. Nurses PRN has a live person available to answer your questions 24/7. Great referral bonuses, $2 every hour worked up to 250 hours or $500. Our staff is here to give you a great experience and help place you at the best facility to suit your needs and wants, along with using your expertise in your field. Nurses PRN is a family-oriented company based on faith and integrity. We are here to work for you and with you. We will always do our best to maintain a fantastic working relationship with you.